Hey guys, so this video is going to be about nursing school orientation and what you can expect on your first day of orientation. So I just got back from my orientation. It was 8 in the morning until 4 in the afternoon. So it's a very long day and there's a lot of information being thrown at you. So it can be a little tiring, like I'm a little tired right now, but it's okay. I want to make this video so it's fresh, so it's great for you guys, so you get all the information that you need. So I'm going to try to go through this kind of quickly. This is actually the second time I've recorded this video because the first one was really long and I was just like, this isn't hitting the main points I want it to, so I'm going to do it again. So, first day of nursing school orientation, what you can expect. Okay, so when you go in, you are going to meet most of your instructors. It's really, really cool because you can tell all the different personalities right away, right off the bat. First, they kind of talk to you about what to expect in the up and coming year. It is quite a bit overwhelming at first because they show you the syllabus and show you like how it's broken down because there's different modules and assignments within those modules and things like that. But the syllabus is 100 pages long. Now, normally a class syllabus is about 20, so I think that's where a lot of the students were like, I am so overwhelmed right now, or at least I was, just because that's just a lot. 100 pages, that's like a textbook. So, but however, I do like the way that it's broken down. Each module goes into what they expect you to know. They're called subcompetencies, and they're pretty much just points that they expect you to know for the certain topic, and there might be like 20 different points under that subcompetency, but we were told as long as you understand those points, but those points are like broken down into a whole like page or two, more information about it, but as long as you understand those subcompetencies, you will do well in the exam. So I like that because that's straightforward, and that is what I do well with. I do well with straightforward things. Know this, okay? Like, you tell me what to do, and I'm gonna do it. That's how I do good, So I was very excited about that. However, it is a lot of information to know and a lot of information to retain. So once you go through meeting your instructors, going over the syllabus for the course, we were then broken into various groups of, I would say 15 students, and we were sent off to different places. So the next place that I went was we have to take a basic math test, and we have to score an 80 or above. And apparently my group did really well, and most people passed, and it's better than all the previous years. They were talking about this to us, and that's really exciting because I'm excited. That means I got a smart group of people I'm going to nursing school with, and it's good we can support each other and encourage each other. After that, they did a brief overview of Blackboard. Most people, know Blackboard. However, you have to sit through this class because for nursing school, I find there were way more folders than any other class I've had on Blackboard. So, they want to break down and show you exactly where everything is within the Blackboard site. Then we met with our nursing skill lab instructors in the simulation lab, which is what I'm really excited about. I thought that our instructors had great energy. We have all these like mannequins around the room, and they actually can input different scenarios, which is really cool. And some of the mannequins, like one of them goes into full labor, so that's exciting. And you can give them shots, you can give them IVs, they'll have pulses, they'll have blood pressures. So it's really, really cool. It's like having a patient that you get to work on, but if you mess up, they won't die, which is great, because who wants that kind of pressure, right? So then after that, we met with the test center people. So in nursing school, at least in my school, I don't know how other schools do it, our exams are on the computer. We have to take it in the test center at school. We're not allowed to have any supplies or backpacks or sweatshirts or hats or anything like that. You go into this room, they're not timed. However, there's 50 questions and you answer them and then you leave. The thing that's nice is on your syllabus, we have a deadline. So like our first 2 exams have to be done by September 21st. Anytime between now and September 21st, I can walk into the test center and take those exams, which is great. So I schedule the exams. It's on my time, so that's wonderful because I test so much better in the morning, and so I'm very excited about that. So the only thing with that is they kind of told us don't wait last minute, because if a lot of people wait last minute, there's only so many computers, and then also if something happens, like you get sick or your child gets sick or something happens, it has to be done by that deadline. So so after that, we met with a librarian. She kind of went over how to write research papers, how to research for a research paper, in the sense of what does our school and our library offer in the sense of research and finding journal articles and things like that. And for me, this was I was starting to fade by this point because I had no breaks, and this was the last one of the day. And as you guys know, I worked in research for a long time, so EBSCOhost, PubMed, all of those things, I'm very familiar with. So I was just kind of like sitting there like this, falling asleep, but I really wasn't. But I was like, oh, I want to go home and eat some food. So let's see. After that, we did basic things. They encouraged us to get a locker, which I got because I'm a tiny person. I can't carry all of these things. Like, I need a locker to put my stuff in. Especially, another thing, we went and we bought the books, or they told us to, so I went and got the books, and I almost couldn't carry them all. They came in a big box, and they're really heavy. Me and my brother decided it was about 45 pounds, which maybe you guys are like, that's not that much, but that's about half my body weight, and I could barely lift it across campus. I almost had to call somebody to come help me, but I got it. But it's a lot of books, and when you look at all these books, it's a lot of information that you realize that you have to retain. So I think that's where people kind of got a little overwhelmed when you see all the books and you see the 100-page syllabus and all these assignments and when they're due. So, it really encouraged me to focus on not only school, but also my mental and physical health. And so I'm going to have a whole video on how I set up my life in nursing school, because really finding that balance, for me at least, is super important, because I am a perfectionist and I will burn myself out if I don't think about my mental health as well as my physical health while I'm in school. So I think kind of pinpointing the type of person you are, knowing your strengths and weaknesses, and being able to build your life around that is super important. And going to orientation, seeing all the information we need to know, seeing all the work we need to do, really encouraged me to sit down and make a game plan. So that's actually what I'm going to do after this video. So let's see. After that, we just got our IDs. We met our advisors, who are actually some of our professors, and we're all assigned to one of them. So anytime we have a problem or we need advice, we can go to them. However, each professor does have office hours too, so that's nice. And I'm a big fan of office hours because I'm the type of person, I don't like to ask questions in class. I don't like talking in front of people. I don't like standing out. I like to keep quiet to myself. So I'd rather kind of it be like one-on-one, So that makes me happy. Let's see, what else do we have? Just a lot of paper, a lot of information, a lot of resources. I'm very excited. Oh, let's look at the books. Okay. Sorry, I gotta lean over. Okay, here we go. So first, these two books, they are recommended but not required, so I just signed them out from my library, and I was skimming through them before school started. So those are two. Then these are the required books. So all of the books except this one I'm going to show you next came in a bundle, and it was cheaper to buy it from my school in the bundle than get them used. However, I got this one used, but it's in new condition. It comes with the CD in the back and everything, and it was only $8. So this is the first one, Nursing Process and Nursing Diagnosis, and apparently we will read that whole book, which is not, it's not a big book. Then we have Physical Examination and Health Assessment, so it's like this. Then we have Medical, Surgical, Nursing, 2 books. Then we have an access card. Then we have Towards Healthy Aging, so this one's not too bad. Okay. Then we have Fundamentals of Nursing, These are heavy. That's a heavy one. Pharmacology. Woo. And clinical nursing skills and techniques. So it's a lot of information. You know, this could definitely get very overwhelming if you are not prepared. So that is the end of my orientation video for you guys. I hope that this kind of gives you a little insight into what your orientation for nursing school is going to be like, because of course before you go it can be very nerve-wracking. What's going to happen, what's it going to be? So this is what mine was like. I would assume that yours would be very similar. And yeah, if there's any other questions you guys have, just leave it below and I will comment you back. If you have any recommendations for videos that you would like to see, make sure to subscribe below and also comment. And I will have lots of videos coming soon. I'm very excited that nursing school is starting because that's really what I wanted to focus this channel on. It's just kind of like nursing and health and things like that. So now that there's all of these things happening, I have so many awesome ideas for you guys that I can't wait to share. So if you want to join the family, make sure to subscribe below. All right, thanks guys. I'll see you later. Bye.